So good afternoon, good people. And welcome to Life Clinic with Dr. Chris. I'm very excited to have you all joining me this afternoon. Today is April 11, 2021. And I wanted to do a Life Clinic today because it is almost 1 year to the date when I lost my father. My father, Timothy L. Purnell Sr., known as Apostle Father Purnell, Daddy, Big Tim, to so many different people in my family, my church family and friends. He lost his life on April 13, 2020. My father had coronavirus, but he survived a host of so many other conditions. And this is about celebrating his legacy. This is about sharing power through stories, sharing power through knowledge, sharing power through information, so that we can save the future and save as many lives as possible and put our households, our families, our communities, our nation, our state, the world in a better, a more healthy, a stronger, more successful perspective and position. So I'm really excited. So we're going to jump right in. Today, I'm going to do a little bit of a review. I always start with a review to let people know who I am and then to let people know where we are in this pandemic. So again, I'm Dr. Chris Purnell. I am a board certified preventive medicine and public health physician. I am a fellow of the American College of Preventive Medicine. And this is a labor of love, a labor of passion, and a labor of purpose. This is heart work for me, being a public health physician and a health equity champion. And so it is more than a sense of professionalism or even duty. This is my calling. This is my ministry back unto the beloved community, as our great hero would say. So I'm going to go ahead and I'm going to start with the slides. So for those of you who may not know, I'll be using different terms. I'll say coronavirus to summarize the current infectious agent or pandemic that we're dealing with. COVID-19 means coronavirus disease 2019. Coronavirus is actually a family of viruses, and COVID-19 is a specific coronavirus that emerged in that year, and the specific infectious agent is SARS-CoV-2. So I just want to put all of that out there because I'm going to throw out all of those different terms. If you have questions, please feel free to put the questions in the chat. I have great people helping me today to make sure I acknowledge and address any and every question people may have. I can see some of the questions in my feed right here, but I can't see all of the questions on Instagram. So if there are questions on Instagram, again, I will get to them. And if there's anything that doesn't get answered today, feel free to leave your question and I'll circle back. And the next time we do a live clinic, I'll be sure to include that, or I'll just respond to you in real time as soon as I have an opportunity. So let's start with sharing some slides. All of you know I'm also a professor. I love to use slides, so just bear with me here. I'm going to pull up my slide deck so we can begin this process. Okay, so hopefully everyone can see my slides. If my trusty helpers could just send me a message and ensure that everyone is able to see the slides, I would really, really appreciate that. So Life Clinic with Dr. Chris. Okay, so starting again with my father. This is my father, Timothy L. Purnell Sr. As I mentioned previously, he lost his life on April 13th, 2020. And, you know, he was just a character. I always love showing this picture of my father smiling, and you see me smiling because he was a very big personality, hence why he was called Big Tim. And so my father survived so many different things. Though coronavirus ended his life, sorry for that, though coronavirus ended his life, It did not end his legacy, and it did not end his story. 1 second, people continue to text me, and my phone is not on silent. So let's take care of that. It did not end his story, and we are using his story. It is important to note that he had multiple chronic health conditions, because you will see when I talk about disproportionate risk, okay, meaning differences in risk for different racial and ethnic groups. When I talk about disproportionate risk, some of these details will be pertinent and integral to that disproportionate risk. So my father had a host of health conditions. I've shared before, my father was living and surviving HIV/AIDS. My father had end-stage lymphoma and severe emphysema, as well as a host of other conditions. He was a conqueror. He conquered the Jim Crow South. He was a research scientist. He worked at the famous Bell Labs, and also went on to be a professor and instructor at the University of Virginia. So his story will be important as we highlight why Black and brown communities were disproportionately impacted. And then I wanted to share this woman, this beautiful, blessed soul. I have said this on so many different news programs, and I say my social media feed is filled with young people who are still losing their lives to coronavirus. And people, I need you to hear me. I know you're tired. I know it feels like we have been in this battle forever, but people are still losing their lives. And this is why it is so important, so important for all of us to do whatever necessary to save lives. And so I saw this on Twitter, and her mother posted this. Her mother is Laverne Jones Lemons. This was in the public domain. This is why I'm sharing it. And she wrote this April 10th, 2021 at 12:59 a.m. My beautiful daughter, 43 years old, LaRoisha M. Jackson, RN, 10 years, RIP, my sweet and beloved daughter. In just over a month, she lost her battle to COVID double pneumonia, 9/16/1977 to 3/10/2021. Lord help. And so, though you may be tired, there is a sense of urgency and vigilance we all need to display so we can finally beat back this pandemic and we can save our future. I'm starting to use that intentionally. We can save our future and save lives, and in particular, save Black and brown lives who have been disproportionately impacted by this pandemic. So let's go over some facts. And yes, I know for those of you who may be joining on Instagram you can't see the full slide. So I know some people don't have Facebook. That's why I wanted to have my Instagram feed also up and running, because there'll be a portion where I won't be sharing slides. I'm always going to talk through or read through what's on the slide. The first confirmed laboratory diagnosis of coronavirus in the United States was on January 20th, 2020. Remember that date. Okay, and I'm using that for us to be able to say from January 20th, 2020 until today, this is the level of destruction that coronavirus has caused. Over 558,000 deaths. This is reported by the CDC. There have been nearly 31 million positive cases or infections to date. The US 7-day moving average, so averaging the number of new coronavirus cases on a daily basis, that number right now is approximately 66,000. When you hear the CDC director, and that's Dr. Walensky, or when you hear Dr. Fauci say that the baseline level of infections in the nation is concerning, that's the number that they're looking at. They're looking at that 7-day moving average. And it's very important for everyone to understand that's a high baseline. So we're saying off of that baseline, if we see an explosion in the cases due to variants, the likelihood that the surge would be even that more severe is higher. This is why we have to continue to follow those public health measures. And what are they? If you can, say them to yourself right now. I'm gonna give you a few Jeopardy moments. Do 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 do. Okay, everybody should be wearing a mask. Whenever you leave your house, you should be wearing a mask, and you should be wearing a mask properly. over your nose, okay? 2, you should be practicing frequent hand hygiene, washing your hands. If you don't have soap and water, warm soap and water, you can use the hand sanitizers. And 3, you should be practicing physical distancing. When you are around people who do not live in your household, you should be at least 6 feet apart. Now, there are some caveats to that. That we will get into. And finally, avoid indoor, crowded, and cramped places. I can't emphasize that enough. Even if you've been fully vaccinated, practice those public health guidelines that I just shared all the time when you are in public. And this is not the only impact of coronavirus. Coronavirus is not only killing people, coronavirus is leading to significant, what we call morbidity, meaning debilitating effects on your health, okay? In addition to that, coronavirus has caused widespread economic devastation. We have referred to this in the popular sphere as a she-cession or female recession, because women have disproportionately been impacted economically by this recession. Women have lost more jobs and have been added back. Black and Latino women in particular have been the worst impacted in this recession. So, important. When I show you those stats, a very easy thing for you to remember, because there are still people out there. There are people out there who will say things like, oh, coronavirus is not that important. Oh, people are, being sensational. I have had people call me all types of names. I have had people say things about me on Twitter, say things about me on Instagram, say things about me on Facebook, and say, oh, people are using you as a Black woman to spew lies to the Black community. False. Wrong answer. Okay, I am bound by more than a code of ethics. I am bound by being a vessel of goodwill by the Heavenly Father, Yahweh. You all know that I'm also an apostle. Shout out to Beth Hashem Yahweh Worldwide Ministries. Shout out to Yah Squad. It's a movement, people. And so getting back to what I was saying, I want you to learn these stats so that you can share these stats. So when someone says to you, oh, coronavirus is not that serious. Oh, coronavirus is just like the flu. False. In the year 2020, the CDC has released provisional data. Okay, and the National Vital Statistics System rolls up into the CDC. So the CDC has released provisional data. In 2020, the greatest amount of deaths were caused by heart disease. The second greatest amount of deaths were caused by cancer. The third leading cause of death in 2020 was due to coronavirus. Remember, before 2019, the very end of 2019, and the beginning of 2020, we had not heard of coronavirus. Yet it was the third leading cause of death in the United States. That is not a hoax. My father's life is not a hoax. The young woman that I just profiled is not a hoax. My 2 cousins, Thomas Franklin Boswell Jr. and William Boswell Jr., those lives were not hoaxes, okay? And so just take a minute to look and see in comparison how many lives were lost due to COVID-19 or coronavirus versus flu. That's another thing I hear from people. Oh, this is just like the flu. Now, the last time I did an episode with you, I showed you a slide. I showed you a slide to say how many people had died via the flu over the past near decade. And as you can see, yet again, it's just not comparable. Actually, this past flu season was very mild to almost non-existent. And that's likely because of the public health measures we were following to protect ourselves and to prevent coronavirus infections that also prevented transmission of the flu. Okay, so just to further build on this slide of coronavirus or COVID-19 being the third leading cause of death, I also wanted to show this slide that I got from a published graph in NPR. Okay, I wanted this slide because it gives you numbers. Now, heart disease and cancer are 2 prevalent conditions that we should work on every day, that we should work on instructing and sharing information for people how to prevent heart disease and cancer, and also how to enact lifestyle changes, behavioral modifications that will make those conditions less likely. But there are also things outside of an individual's control, environmental factors, where you live, what that environment is like, what the stressors you're exposed to, toxic stress, right? But still, again, the point is COVID-19, third leading cause of death. Look at the numbers. This is also why I wanted to show this version of this information. So 345,323. Again, this is provisional. People died in 2020. That doesn't capture every death, right? Because we're over 558,000 or so. But look again how many people died to the flu. 53,495. And I have to say that because that's a myth that we need to do away with. Because actually it's hurtful and it's disrespectful. It's hurtful and it's disrespectful to those who have lost their lives. And it's hurtful and disrespectful for those critical infrastructure workers, essential workers, frontline workers, every person on that line trying to live through an unprecedented public health crisis. Okay, a tale of two Americas. Whenever I speak to you, I'm never gonna have a dialogue with you and not talk about health equity, not talk about health justice, and not talk about racial justice. Because one, that's true to who Dr. Chris is, the good Dr. MD, the people's physician and apostle of public health. And two, it is everybody's responsibility and accountability to know this so that we may change it and transform our nation. A tale of two Americas. This is a prolific woman. I strongly encourage those of you, if you have never heard of her, to look her up. She's now the dean at George Washington, their law school in DC. She is an author. She is a sociologist, a leading thinker around the area of implicit bias and just racism in healthcare. So Dean Dana Bowen Matthew says, what we politely call a health disparity, and I'm reading this for those of you on Instagram, what we politely call a health disparity is killing people of color daily. It is causing people of color to live sicker and die quicker because of the color of their skin. I still encounter people who say, well, are you sure that there is a pre-existing condition that predisposes persons of color to worse outcomes? And I say yes. And I use that language deliberately because in a couple of slides, I want to tell you what that pre-existing condition is. And I want everyone to walk away today understanding racism as a pre-existing condition. Okay. And I want to follow this up with, of all the forms of inequality, injustice in health is the most shocking and the most inhuman. Let's say there, inhuman, because it often results in physical death. Reverend Dr. Martin Luther King Jr., the Reverend Doctor. And so I oftentimes like to use these quotes to shock our systems back into transparency, authenticity, and to charge and issue a call to action around change. Okay, so let's get into some stats again, all right? I shared this previously. This is updated information. COVID hospitalization and death by race and ethnicity. The CDC describes race and ethnicity as risk markers for other underlying conditions. That's why when I told you my father's story, I said it's going to be important to know that as a 78-year-old Black man who had certain chronic health conditions, he ultimately succumbed to coronavirus. When we were earlier on in the pandemic, the epicenter of the pandemic was very much in New York and New Jersey back in March and April, and we're actually seeing hotspots emerge in 5 states across the United States, Michigan being the worst, New York, New Jersey, Pennsylvania, and Florida. When we saw that, we were saying, well, is it because they have chronic health conditions? And that actually is not the most thorough, the most complex and valid way to understand what's going on. The fact that people are saddled or burdened with underlying conditions is rooted in social determinants of health. Social determinants of health are some of the things you see in that CDC quote: where you live, where you work, where you play, meaning where you have your recreation, where you are born, where you age, where you worship. Those social determinants of health, SDOH, you may hear people say, those things drive health outcomes and actually influence and shape behaviors more so than access to care. But access to care is important and is also a social determinant of health. So let's look at these numbers really quickly. Let's focus on hospitalization and death. If you look across the persons and communities of color, You see that Blacks, the Latinx community, American Indian or Alaska Native, have disproportionately experienced higher hospitalization and death rates, okay? Anywhere from 3 to almost 4 times higher in hospitalization, anywhere from 2 to about 2.4 times or more. You'll see another research group which reports higher. Now, let's talk about Asians. Asian Americans represent, the Asian and Pacific Islander community represents a very diverse community, diverse in ethnicity, diverse in socioeconomic status. And so while these numbers don't tend to suggest as disproportionate an impact as other groups, it is important to understand that there's going to be diversity in that impact across states, across regions. In New Jersey, coronavirus was the leading cause of death for Blacks, Latinos, and for Asian Americans in 2020. That's an example of that. The second group, know this group. As you will see, I frequently cite persons of color because we need to put forth diversity and inclusivity in our scholarly endeavors. So Dana Bowen Matthew is a phenomenal woman. She's a Black woman. I cited the Reverend Dr. Martin Luther King Jr. I'm going to tell you about the work of APM Research Lab. There's a whole movement about cite Black women. So cite Black women. And the Color of Coronavirus Project, typically on a monthly basis, although it hasn't been updated yet in April, shows how coronavirus has disimpacted different groups, okay? So here again, similar data as to the CDC, all right? And that similar data also shows similar risk-adjusted mortality, age-adjusted mortality rates. And again, in the Indigenous and Pacific Islander community, that could be anywhere from 2 to 2.6, Latinos 2.4, Blacks 2 times worse. But if you begin to break down that even further, you get a fuller story. So also, the National Center for Health Statistics, which rolls up into the CDC, published preliminarily, which it does not typically do, mortality data. And mortality data for 2020, just looking at half the year, looking at from January to June, the entire American population lost 1 year off of its life expectancy. That's unheard of, and it's very unusual. I think the last time that may have happened was around the Depression. And if you then parse that down further, Blacks experience about 2.7 years off of their life expectancy. The Latinx community about 1.9, and whites about 0.8. And it is important to know that those groups were chosen because those are the groups that the most complete data was either collected for or available. If you break that down even further, of those groups, and you look at, I'm going to use another term, intersectionality. So not just looking at one demographic factor, but looking at 2 or more, multiple demographic factors. So if you look at Black males, if you look at Black females or Latino males or Latina women, you begin to see just how the disproportionate impact has been. And typically, the Latino community has had a longer life expectancy, even longer than whites in the United States. But we have been disproportionately, we in communities of color have been disproportionately impacted by coronavirus. Okay, so Black men lost 3 years. Now, this 3 years is either directly due to being infected with coronavirus and dying, or because of the COVID-19 pandemic, people delayed care, getting health care, or people didn't get care at all. So foregoing care or delaying care. And that's catastrophic. And this is how this pandemic, this fast pandemic, is colliding with this slow pandemic of systemic racism and is stealing Black and brown lives. Another stat that I have to give you, okay, and these things are important. I'm making the case for why racism is a pre-existing condition, because racism is one of the systems, one of the forces that shapes social determinants of health. You say, well, how's that true, Dr. Chris? Because racism impacts access to care, racism impacts the quality of care received, and racism impacts access to life conditions, meaning racism impacts the conditions in which people are born, live, play, pray, age, and get educated. That's how we see this disproportionate impact on Black and brown lives. And this pandemic, if it has taught us something positive, what it has taught us positive is that we can no longer, and this is a positive, we can no longer afford to deny the need for health equity and to lead with health equity, not just to follow. What is health equity? Everyone having the opportunity to achieve their highest level of health. That's health equity, okay? All right, so the Brookings Institute back in June, and the Brookings Institute had quoted Dean Dana Bowen Matthew in that quote that I gave you before, a phenomenal piece. And it talked about how it is not just accurate to look at those age-adjusted mortality rates that I shared with you, but to go deeper within the age groups or age brackets. And these are two quotes. In every age category, Black people are dying from COVID at roughly the same rate as white people more than a decade older. This is why equity physicians, equity practitioners, equity scholars kept screaming when states are designing eligibility criteria for vaccines, meaning who is able to receive a vaccine. Age really became a false measure to capture those most at risk, because Blacks at younger ages bore disproportionate risk, okay? And it's very important for you all to understand that, and this is gonna break that down. So in every age category, Blacks were dying at roughly the same rate as white people a decade older. And this pandemic has been disproportionately devastating for the older population. I won't deny that. But for every age category, Black people are dying at the same rate as white people more than a decade older. What's aging Black people? What's making, and I use aging deliberately, what's making it riskier? Racism. Among those aged 45 to 54, Black and Latino death rates are at least 6 times higher than for whites. I'm within that age category. You know, people never know how old I am. I'm 45. It's not a secret. The woman that I just highlighted, 43. Sit with that. I want everyone to sit with that for a minute. And this is another stat I want you to walk away with. One, I want you to walk away with knowing that this is not a hoax. The next time you hear someone say a hoax, just say, my brother, my sister, ma'am, sir, excuse me, good people. That's not true. And that's disrespectful to all the lives that have been lost. And for those who are living with coronavirus and are still struggling with lingering symptoms or symptoms, and how it has totally devastated our nation and the world. Okay, so we talked about how coronavirus disproportionately has impacted Black and brown lives through death. Coronavirus, what we know now is at least a third of all of those who were diagnosed with coronavirus have some lingering either mental health and or neurological deficit. And I wanted to start with this photo of my beautiful, beloved oldest sister, Kim Maria. And she's a survivor. She's a hero. She's an overcomer. My sister overcame breast cancer. Hence, you see this lovely fro on my head. I cut it, and I'm thankful to her because it gave me the courage to do that. And I'm so glad I did that. My curls, they're not moving right now, but when they're wet, they're moved. But power to my fro. And so, you know, her story is so prototypic of so many others. It took my sister over 10 months to get back to her baseline. And that meant to be able to return to work. That meant to, you know, not have so much debilitating symptoms that she couldn't go about her activities of daily living. And now we have that data that a third of people with coronavirus have lingering mental health and neurological deficits. That's anxiety disorder, that's depression. We see things like insomnia. We see strokes. We see bleeding in the brain. And there are, you know, different theories as why that's true. Is that true because there is this inflammatory response and this hyper-inflammatory response, and this is what is happening, or is it happening because specifically, you know, there's leakage and bleeding of vessels in the brain? But we know that we have to continue to understand coronavirus because it doesn't only kill, but it seeks to rob people of vitality. Okay, we're almost done with the slides. Vaccinations. Where are we with vaccinations? Hey, I just got a text. Everybody stop. Bop, 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 bop. Another person just got their first dose of coronavirus vaccine. So I get really excited when people get vaccinated because I'm about saving the future and I'm about saving lives. And if you know me personally, you know I take this seriously. And so right now I have a pledge. I have something to ask each of you. Please ask 5 people in your sphere if they've been vaccinated. And if they have not been vaccinated, help them get vaccinated. Know where there's a FEMA site. Here in New Jersey, there's a FEMA site in Newark, New Jersey, where you can call and make an appointment. Know which healthcare or hospital settings are offering it. Know which pharmacies are offering it. Use the Twitter bot. Go online. Help an older person. My sister, shout out to my big sister, Allison. You know, she was helping me with some dear people to our lives, to where I live here in Montclair, to help some older people get vaccinated. So I'm asking anyone watching today to ask 5 people. What if every person who liked Life Clinic, first of all, if you haven't liked Life Clinic on Facebook, like Clinic on Facebook. And if you're not following me on Instagram, follow me on Instagram at The Good Doctor MD. If you're not following me on Twitter, follow me on Twitter at Dr. Chris MD. And I say all of that so we can keep this prevention army growing. Okay? Ask 5 people. And if all of the people who followed right now, if you each asked 5 people if they've been vaccinated and then, you know, help them to get vaccinated and then ask them to do the same, we can get to community immunity. You have heard the term herd immunity. I like to do Dr. Carlos Del Rio, bless him, a vaccine researcher and scholar out at Emory. I've been on several panels with him. He's great, he's great, he's great. And he was like, you know, I use community immunity. And I said, I'm going to start to use that. So community immunity. We know we need anywhere between 70 to 85% of the population to be vaccinated to achieve community immunity. And again, what that means is that coronavirus will be less likely to be transmitted because so many people will be vaccinated so we can control it and it doesn't surge and cause the level of destruction that it's causing currently. So that's community immunity. So right now, as of April 10th at 6 a.m., this is when the CDC released this data but posted it later in the evening, over 183 million Americans have been vaccinated or administered a vaccine. Over 117 million had at least 1 dose, and over 70 million have been fully vaccinated. I'm of the fully vaccinated crew. I know my family, all of my siblings were in the fully vaccinated crew. I'm working on my father and my mother's siblings, my church community, anybody and everybody to get people into the fully vaccinated crew. We're going to talk about those who still haven't been vaccinated and what questions and concerns you may have. But look at the numbers. Roughly 35% of Americans have had at least 1 dose, and roughly 20% of Americans are fully vaccinated. We need to get to 70 to 85%. Let that just rest. That's why I need you. That's why we need one another. And we have to think about, and from a global perspective, viruses don't respect borders. So getting Americans safe, we need to think about also how are we getting the globe safe. What does Dr. Chris say? Yes, I'm speaking in the third person. Get safe, stay safe. Okay, so just a few more slides. And if we think about who those vaccinated people are, the CDC also released this data. Look, and it's just critical because we don't have as comprehensive data as we would like to have. I'm checking text because people are sending me questions. 55.3% of the people for whom of that 117 were administered at least 1 dose, race and ethnicity data was available, okay? Of that 55.3%, you can look to see who was vaccinated. Roughly 10.9% were Latino. But then look at that gray bar. That gray bar shows their representative share of the general population. So you should be at least vaccinated at the same rate as your representative share in the population. And it's not happening for Latinos, it's not happening for Blacks, and it's not happening for Asians. We have to work on that. And if you look at fully vaccinated, again, over 70 million people have been fully vaccinated, but race and ethnicity data was only available for about 57.5% of those people. And of that, these are the stats. 8.8% of Latinos. Again, look at their representative share of the population, getting close to about 20. Of whites, 68.5. That's greater than their representative share of the population. Let's look at blacks, 8%, and that's less than their representative share of the population, quoted about 12 to 13%. And the same is true with Asians. And if you look at Asian Americans, Alaska Natives, and you look at Native Hawaiian and other Pacific Islanders, what the CDC is reporting is that we're doing comparatively better in those BIPOC groups. BIPOC is a term that I don't totally love yet, but it is useful. It's Black, Indigenous people or persons of color. That's what BIPOC means, the acronym. And so this is why equity, leading with equity, is important. We need to think through, how do we get Black and brown communities vaccinated? Why? Because justice. That's why. Justice. Equity is not equality. Equity is rooted in need. If you have more needs, then we should have actions, we should have strategies, we should have interventions targeted at those needs so that we can help those groups achieve the same level of healthiness, the same level of success, the same level of prosperity. That's equity. And then when we totally remove those barriers, or we totally redefine the playing field, we have achieved justice. And before I stop my slides, I don't ever want to not say their names or to forget. I mentioned earlier my two beloved cousins that lost their lives also to this pandemic before the new year. Frankie, as we called him, Thomas Franklin Boswell Jr. and William Boswell Jr. Just to say a little bit more about Frankie, because I knew Frankie, really well as a little girl. He was definitely a favorite of my mom. And so he was a postal worker, and it's important to share that. I didn't share about my sister. My sister works in a large chain retail store, didn't have adequate access to PPE early on in the pandemic and got exposed at work, most likely exposed at work. My cousin was an essential or critical infrastructure worker, a postal worker, right? Constantly interfacing with the public. My cousin got exposed. His doctor presumably treated him for an upper respiratory infection, gave him antibiotics. And that went on for some period of time. He didn't get better. And ultimately, my cousin suffered a catastrophic stroke. Coronavirus predisposes you to clotting. And he never recovered and lost his life. Those details are important because access to quality care, access to PPE, access to testing, working at the type of job that you can work remotely from. That is not true for all people. Black and browns work disproportionately in fields where they could not work remotely, or they worked in jobs where they didn't have income protections, so they could take time off and still be paid. So when you're forced to survive and you're like, I have to show up, I have to go to work, you are exposed to a different level of risk. Racism shapes that reality. And I won't shy away from that. And so it's like, in what fuels racism? White supremacy, right? This belief system, this racial caste and hierarchy that white lives are more valuable. That's what we have to destroy in the United States of America. And we can do that. And as we do that, we will lead with equity and we will achieve justice. And the last thing that I'll say about risk factors, what you found is in Black and brown groups, not only were they at disproportionate risk factors because of where they worked. Remember those quotes that I shared with you, right? But they were at disproportionate risk factors because of how they lived. And meaning, not only did they work in a high contact job where people were crowded or they had exposed to a lot of people in the public, they oftentimes lived in homes that were multi-generational, homes that were substandard in some way, that didn't have full access to quarantine, meaning if you've been exposed away from people, or to isolate, meaning you've been infected safely from people. So, Life Clinic with Dr. Chris. Okay, so let's get into some questions. I'm going to stop sharing my screen. Okay, so hopefully we're back and no longer sharing the screen. Okay, so there are certain things that I want to make sure I go through. Okay, I see that point. Some of this is about age. Whites are much older than African Americans and Latinos. Vaccinations have focused on older folks first. Okay, so keep me honest. Make sure I come back to that, because remember the stat I gave you. Now, I want you all to learn how to be your own mini scholars. So when you hear some of the assertions, you can begin to say, but is that totally accurate? Okay, so remember the quote I gave you. The quote I gave you was by the Brookings Institute, their piece that was published. At every age category, Blacks are dying at rates similar to whites who are over a decade older than them. So it's not purely by age. If you look at 45 to 54, Blacks and Latinos are dying at 6 times the rate of their white peers. It's not specifically due to age, okay? So that's just to the point that was raised. Okay, so the first thing I want to go over is how do they work? All right, so Jackie, keep me honest. Those are one of my helpers. How do they work? We have 3 vaccines currently approved in the United States through emergency use authorization. And the first, Pfizer, the second, Moderna, the third, Johnson & Johnson or Janssen & Janssen. I think Johnson & Johnson, Johnson & Johnson is a subsidiary, one way or the other. Okay, so the Johnson & Johnson vaccine is different from the other 2. So let's talk about that. It's the most recently approved through emergency use authorization, okay? It is what we call a vector vaccine. The vector or the carrier is a weakened or attenuated common cold virus, an adenovirus. You take that vector or that carrier and you put in double-stranded DNA, and that double-stranded DNA contains the gene for the coronavirus spike protein. So you have that vector that carries that DNA into the cell. That DNA then gets transcribed into mRNA, and the mRNA gets translated into protein. The body builds spike proteins. You are not getting infected or injected with live coronavirus. You are not able to get coronavirus from a vaccine. Pause. Let's say that again. You are not able to get coronavirus from a vaccine because you are not being injected with live coronavirus. Okay, I want that to settle and rest with you because I hear that still today. I need everybody to understand that. Okay, so that's how J&J works, right? So your body makes these proteins. The immune system says, hey, these proteins don't normally live here. So the immune system has a response, and the response that the immune system has is to build antibodies, to build, activate T cells, and those antibodies and T cells then are ready, primed, and pumped, ready to fight. And so when and if the body gets exposed to coronavirus in the future, your body already has the mechanism to fight it. That's what the J&J vaccine does. The Pfizer and the Moderna vaccines are similar, but they are mRNA, messenger RNA vaccines. What does that mean? So messenger RNA is not as sturdy or stable as DNA, okay? It's a single strand. But messenger RNA is able to have the genetic code for a particular protein, okay? So both Pfizer and Moderna wrap messenger RNA in polyethylene glycol, a fat, a lipid, to give it integrity, to make it sturdy and to make it stable. That's what's in the vaccine, salts and some sugars. And that we think might be what causes adverse reactions for the very few people who experience it, the polyethylene glycol. Okay, so that gets injected into the body, goes into the cells. Again, this doesn't, since this isn't DNA, it doesn't go near the nucleus. It stays in the cytoplasm of the cell, and the messenger RNA gets read by the machinery in the cytoplasm of the cell and creates proteins. So both of them are using proteins, and in particular, they're both using the coronavirus spike protein. None of them infect you with coronavirus. So when people are getting side effects after having received the vaccine, they're not getting side effects because they're infected. They're getting side effects because their immune system is working. Now, please, I have a public service announcement. Beep, beep, beep. The flu vaccine does not give you flu. Okay, a smile. The same way the coronavirus vaccine does not give you coronavirus. So I want people to stop saying that the flu vaccine gave them flu. The flu vaccine, like the coronavirus vaccine, is reactogenic, meaning your immune system starts to get busy, starts to get riled up, boop, 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 ready to fight. Shout out to DMX. And the next time you get exposed to the real thing, you are ready to do battle. That's what's happening, okay? So remember that. So, because I don't want to hear you all say that anymore. Oh, the flu vaccine gave me the flu. No, it did not. It did not. Okay, I love my people. I love you all, but it did not. Okay, and so hopefully we can learn that through this. All right, so that's how they work. Okay, that's how those three work. The messenger RNA is degraded and the body gets rid of it. The DNA, the body gets rid of it. Nothing is left in your body. What's left in your body are antibodies and T cells. Not even the spike protein. All of that is gone. So no. Now, people are still concerned about side effects, short-term versus long-term. So let's talk about that. And I'm also checking questions to make sure I'm hitting some of the things that that people are asking. Okay, so side effects. The most common side effect is the localized side effect, meaning pain in your arm where you got injected. Okay. You might even get swelling in your lymph nodes, right? Lymphadenopathy. That's why they were saying women who have received their coronavirus vaccines should space out their mammogram if possible. Otherwise, don't delay your mammogram because mammograms save lives. Come on, women, make sure you're getting your regular mammograms. USPSTF recommends 50 and older. ACOG is probably they're younger in the recommendation. I'm a preventive medicine physician, so I go by USPSTF. But if you have a risk factor, meaning a first-degree relative in your family who has breast cancer, especially early age onset breast cancer, you should be getting mammograms sooner than 50. Okay, let's not get into that topic today, but I do want to throw out knowledge when knowledge is available. Okay, so can also cause swelling in your lymph nodes. Okay, those are what we call local reactions. The more systemic reactions, the most common, fatigue, tiredness. Okay, the next most common, headache. Okay. The next most common after pain and injection site or tenderness or swelling, fatigue or tiredness, headache, you start to get a host of different things. You can get fever, but it's not very common. I want people to know, but you can get fever. I've had people text me, Doc, is it okay? I have a fever. Yes. It's your inflammatory response working. And if you don't get a fever, it didn't mean your immune system isn't working. It just means this is a way immune system can show evidence of working. Okay, so fever or even chills. Okay, you can get body aches. You can get muscle aches. You can get joint pain. That's why people say it feels like the flu. So, but it's not the flu. Okay, so those are side effects. And those side effects last for anywhere from 24 to 48 hours. And some people, they go on for 3 days, which is rare. And some people, they don't have any side effects for several days, and then they get side effects later. All right, people are asking, should I get the vaccine if I've had coronavirus before? Yes. But aren't the flu symptoms people feel because they were exposed to a strain of the flu? No, Yolanda, let me say that again. The symptoms you are feeling, okay, and I need everyone to understand this. The symptoms you are feeling are not because of an infection. The symptoms you are feeling is because of an inflammatory process. That inflammatory process feels like those symptoms I just described, feels like muscle aches and pains, feels like tiredness, feels like fever and chills. It's not because we've been exposed or reactivate a previous infection or exposure. Okay, and I really want people to learn that so we can stop perpetuating that. Okay, and so I was saying, if you've been infected with coronavirus, yes, you should get the vaccine because the antibody response from the vaccine is more robust, is more rigorous than the antibody response from the natural infection. Now, I've heard people put up all on Facebook and Twitter, this vaccine only works for 6 months. Why am I getting it? I'm not getting this vaccine. Oh, I told you, this is all a ploy. This is all a plan. Stop. The way science and data works, okay, is your friendly suggestion from Dr. Chris. The way science and data works is you only want science and data to report what it can prove. So studies are ongoing. I'm in a study, and what the data was released said that the immunity from the coronavirus vaccines is at least 6 months, because that's how far the data has been collected, right? And as the data continues to be collected further and further, and evidence is shown, you will see reports of how long the immunity lasts. There are suspicions that this immunity will last much longer. And I don't want to theorize. It might be a year. You may need to get an annual injection every year, or it may be even longer. You may need to get an annual injection of a booster because of different variants, which we're seeing right now. The most predominant strain in the United States is B117, the UK strain. The number 2 actually is P1, the Brazilian strain. The South African strain is also flourishing in the United States. There are several strains in California. There are double mutant strains. What we know most conclusively at this point is that the strains that are proliferating are still covered by the vaccines, meaning that you are protected. There is some concern about that South African strain, that it might be able to evade the vaccine more than the other strains. That's why Moderna and others are working on booster shots. Remember, these mRNA vaccines are like, woo, like, whoa, okay, Black Rob, whoa, okay? And whoa, Apostle Pastor Pastor, that's her song too, okay? Check it out. If you haven't seen Apostle Pastor Pastor do whoa, go to her Instagram page at Pastor Purnell, right? Somebody help me out, make sure I get it right. Go to at Y'all Squad Official and see Apostle Pastor Pastor, the app. Do well, check out her podcast, The Lyricism of Life, every Tuesday night, 9 p.m. coming to you with the Bishop of Hip Hop. Shout out Bishop Purnell. Boom, boom. Okay. Always ride with my family. All right. That's how we have to be. And so we know that the immunity is at least 6 months. It's probably going to be further. We know that the vaccines protect against the variants. So yes, if you've had infection before, you should get vaccinated. Should pregnant women get vaccinated? The data today suggests it is safe for pregnant women to get vaccinated. I wanted to check this number, but we're well above 60,000 pregnant women reportedly who have been vaccinated, and about 4,000 are being followed or have logged themselves into VSafe. There have been no adverse effects in pregnant women. A very small study was done out of the Brigham and Mass General, and it showed in approximately 131 persons. And if you divide those up among people who were pregnant, I think about 84 were pregnant, and certain were lactating, and then the others were control group, that in the breast milk, in the umbilical cord blood, and in the blood stream, antibodies were found. So we know that when pregnant women get vaccinated, it provides a level of protection to their children. And if lactating or people, those who are lactating, if they get vaccinated, it provides a level of protection to their children. Okay, so make sure I'm going through I recently got vaccinated. I just got tested to check my status. I haven't received any results yet. Should I be concerned about testing positive? Very, very good question. So what happens is that when you get your first dose, think about it this way. If you have a fight, you got, my crew is hard. Like, maybe their arms are just like this with one dose, but they're all up in your face when you get 2 doses, okay? And so what happens is that with one injection, your immunity is, different studies have shown anywhere from the 50s to the 80s and maybe 90% effective at reducing infection or severe disease, okay? So it is possible for someone to just get 1 injection and then to test positive. It is possible. Mm-hmm. It's not as likely, but it's possible. That's why you have to keep following the recommendations. Again, if I'm fully vaccinated, what can I do? If you're fully vaccinated, you know what you can do? You can still wear your mask when you go outside. You can still practice safe distancing. You can still wash your hands. You can still avoid crowded and cramped places. But if you're inside of your house, you can take your mask off and have others from one other household over, a small group, but for only one household, and you all can have your mask off. You can be around unmasked people who have low risk for severe coronavirus disease also in your household. So those dynamics are usually children, okay? So children have lower risk for severe disease. I heard Dr. Carlos Del Rio also explain it. You probably shouldn't have more people that could eat a pizza pie. Right? So in your house, if you're fully vaccinated and the other person from another single household is also fully vaccinated with your mask off, and if you have children or those who are unvaccinated with low risk of severe disease. Remember, the vaccines prevent severe disease. What severe disease? Hospitalization, staying in a critical care unit, or dying. But we have evidence that the vaccines also prevent infection. Right? That evidence was released about in the past 3 or 4 weeks or so, okay? That these vaccines, Moderna and Pfizer particularly, because that is what was studied, are likely to prevent infections, meaning less likely to spread it and be an asymptomatic carrier as well. Let's see, making sure I'm getting all these questions here. If someone has uncontrollable high blood pressure, is the vaccine safe? Yes. If you have uncontrollable blood pressure, please, I implore you, you should get vaccinated. You should get vaccinated because you are at greater risk to have a worse outcome from coronavirus disease if you get infected. You know what? I want to show you all something. Hold on 1 second. I want to share something. You know how I like to. Okay. Give me a second. Okay, I need my helpers to text me. Can everybody see this? I know on Instagram you may not, but this is important for that question. And this is another question that I frequently get. These are the 3 vaccines that are currently been approved through emergency use authorization. Okay, if of these 3, you see Pfizer is roughly about 43,000, Moderna is roughly around 30,000, and J&J is roughly around 44,000. That's who participated in the study. Blacks were at least 10% in all of those studies. That is a success. I need you all to understand that. If we could get participation in clinical research trials that are the same as the representative population share of that race or ethnic group, we can generalize data more effectively. Okay? All right. So are you not seeing the life? Wait, you can't see the slide? Okay, I think I'm hearing that you're not able to see it. I'm not sure why you're not able to see it. Hold on 1 second. But let me just read the stats to you because it's growing late. Hispanics and Latinos, about 26% in the Pfizer trial, 13% just in the US alone, 20% in the Moderna trial, and 15% in J&J. Of those in the trials, at least 17 to 44% had chronic health conditions. All right, so I want to stop sharing. I think I hit the wrong screen selection, but I wanted to show that to say that if you have chronic health conditions, you should get vaccinated. Even if you have autoimmune conditions, you should get vaccinated. Start with a conversation with your doctor, but you should get vaccinated. Because if you get coronavirus, it is worse for you. You could have a worse presentation of the disease, okay? Let me say, let me check a few more questions that I was getting. I got the first dose of the Pfizer vaccine. Is it accurate to say that medical providers are getting this vaccine at a higher rate than others? You know, I can't comment on that. I really can't because allocations are happening at the level of state Department of Health. And that can be different per state. And it depends on how the federal government even distributes or allots the different vaccines to the states. So I can comment on what is more likely to be at a doctor's office versus what is more likely to be at a hospital. Most doctor's offices aren't able to do the ultra cold storage that is required for Pfizer. So that might be less likely to be at a doctor's office, but a Pfizer could be at a hospital setting, or a Pfizer could be at a FEMA site, or a Pfizer could even potentially be at a pharmacy. The more mobile vaccination units, those that get deep into community, those that go to people's homes and things of that nature, are more likely to use vaccines that don't require as ultra cold storage. Moderna requires cold storage, but not as ultra cold as Pfizer. J&J, the refrigerator shelf life is 3 months. So it's the longest refrigerator shelf life of all of them. Is it safe for someone with kidney disease? Yes, it is safe for someone with kidney disease. As I just showed, if you have chronic health conditions, you should get vaccinated. You should get vaccinated because your risk of severe outcomes with coronavirus is higher or worse. Okay, let me just check some more questions. Soreness in your arm. Soreness in your arm, how long it lasts. Like I said, those symptoms can be anywhere from 24 to 48 hours. It's very rare. Some people are longer than that. Some people have delayed hypersensitivity reactions, meaning nothing for the first 5 or 7 days. Then they get a rash or welts or hives on their arms. I want to differentiate that from an immediate allergic reaction. An immediate allergic reaction is something that happens within 4 hours of the dose being administered. If that happens, you should not get the second dose of that vaccine if it's a 2-dose vaccine, okay? Because that's a different level of a reaction from your body. I'm just checking to make sure I've gotten all the questions before we have to sign off. Is it safe to get tested if you have strong allergies? It depends by what people mean by strong allergies. If you have a history, a known allergic history to the ingredients in any 3 of the vaccines, you should not get vaccinated. Now, how would you know if you have a history of allergies to any of those ingredients? You may have had an allergic reaction to a different vaccine, and maybe you've had testing and you're able to say, hey, I'm specifically allergic to that. But if you have that concern, have that conversation with your primary care physician. Don't ever hesitate to talk with your primary care physician before you do any health related intervention or health related behavioral change. Involve your doctor in those discussions and decisions. You can have had an allergic reaction to one vaccine and still be able to get this coronavirus vaccine because the ingredients may not be the same. But you should have that conversation with your primary care provider. Okay, I'm gonna do one more check. Okay, one lady, she got both shots of the J&J and tested positive for COVID. Something is not correct there because J&J is only 1 shot. The only way someone who will have gotten both shots of J&J is if they were in the coronavirus vaccine trial that J&J was doing, because J&J was looking at those who got 2 shots versus 1 shot to see if the immunity was different. So that would be very unlikely that she got 2 shots of J&J and then tested positive for coronavirus. So let's get some more details on that. But what may have happened, let's say she got 2 shots of the other vaccines and got coronavirus. That's possible. And if you get coronavirus, it will be weaker, your experience of it, and most likely you will not be hospitalized, you will not be in a critical care unit, you will not lose your life. Everyone's immune system is a little bit different. And when they did the studies, when it says it's 90% effective, or if the efficacy, that's the clinical setting, real world language is effectiveness. But when it says it's 90 or 95% efficacy, it means in the vaccinated arm, and those who were vaccinated, there was a 95% reduction of coronavirus infections and disease. Doesn't mean you're 95% less likely. It just means there was a 95% reduction. So it's likely that a very small population will be vaccinated, right? Because it's 95. A very small population will be vaccinated and may not have full protection. There were people in my trial who were fully vaccinated. Fully vaccinated means 2 weeks after you complete the series. I hear people say, I got my second dose, I'm fully vaccinated. Fully vaccinated means 2 weeks after you complete the series. That's when you get vaccinated. I mean, you're fully vaccinated, okay? So I think I've answered every question that I saw. I'm gonna do one more scan. If someone has had epilepsy or seizures, can they be vaccinated? Yes. There isn't a contraindication for those who have had epilepsy or seizures not to get vaccinated. Where can I go as a reference for the 3 different vaccines for information? I want knowledge of each. The CDC has a great summary of each of the 3 vaccines. It explains what's Moderna, it explains what is Pfizer, and explains what is J&J. Again, most times you are not going to have the opportunity to have a choice in what you get vaccinated with. And I'm going to say this clearly, emphatically, and with all confidence. They're all the same. They're all technically the same. If you have whatever vaccine you have access to is the vaccine that you should get vaccinated with. One more check. And I think, let's see. Do you need to wait 90 days? Okay, so 90 days is the CDC advises if you had coronavirus and you were treated with monoclonal antibodies or convalescent plasma therapy, you should wait 90 days. Certain health systems are telling people if you had coronavirus infection at all, whether or not you were treated with monoclonal antibodies or convalescent plasma therapy, you should wait 90 days. That's not necessarily the CDC's instruction. You can be vaccinated at a minimum once you are no longer displaying symptoms, you have completed the quarantine or isolation period. That's when you can get vaccinated. But if you've had monoclonal antibodies or convalescent plasma therapy, wait the 90 days. So I want to thank all of you for tuning in to this Life Clinic episode. We will continue to do this. We'll continue to come back, and give more knowledge, share knowledge. Look, if you're still not ready to get vaccinated, I just want you to know the risk. I want you to know the risk of being unvaccinated. And the risk is high. And the risk is higher if you're Black or you're Latino. That's just the bottom line. It's higher. So you're taking a risk by not being vaccinated. And so look for me on Twitter, Dr. Chris MD. Look for me here on the Life Clinic Facebook page. Look for me on the Good Doctor MD. And look for me on CNN, MSNBC, or any other station near or far. We are in this together, and we are going to achieve community immunity, but we're not stopping with that. We're going to achieve health and racial justice. Power to all people. Have a good day.